Welcome to the YouTube channel Dr. Mai, sharing medical knowledge. In today's video, we will explore a critical topic, brain bleeds. This condition is not only life-threatening but also demands urgent medical attention. We'll dive into what it is, how it happens, and what can be done to treat or prevent it. Before we get started, don't forget to subscribe to our channel, give the video a thumbs up, and leave a comment about any medical topics you're curious about. Your support helps us grow and bring more valuable content to you. What is a brain bleed? A brain bleed, or intracranial hemorrhage, is a type of stroke caused by bleeding within the head. Your brain needs a constant supply of oxygen and nutrients, and blood vessels carry these essentials. When one of these vessels bursts or leaks, it leads to blood pooling between your brain and skull, increasing pressure on your brain tissues. Without immediate treatment, the brain tissue starts to die within minutes due to lack of oxygen. This condition often follows falls, traumatic injuries, or occurs in people with high blood pressure that's not properly managed. A brain bleed is a medical emergency, and quick treatment is crucial to increase the chances of survival and recovery. Types of brain bleeds. There are different types of brain bleeds based on where the bleeding occurs. 1. Bleeding outside of the brain tissue. Epidural bleed occurs between the skull bone and the outermost layer of the brain's protective membranes, the dura mater. Subdural bleed happens between the dura mater and the middle membrane layer, the arachnoid. Subarachnoid bleed occurs between the arachnoid membrane and the innermost layer, the pia mater. 2. Bleeding within the brain tissue. Intracerebral hemorrhage. Bleeding occurs in the lobes, brainstem, or cerebellum within the brain tissue. Intraventricular hemorrhage. This type affects the brain's ventricles, where cerebrospinal fluid is produced. Are brain bleeds fatal? Yes, brain bleeds can be fatal. The outcome depends on several factors, including the location of the bleed, the size of the bleed, and how quickly treatment begins. Once brain cells die, they cannot be replaced, which can lead to permanent brain damage and complications like paralysis, memory loss, or speech difficulties. However, early intervention can significantly improve outcomes, which is why immediate medical attention is crucial. How common are brain bleeds? Brain bleeds are a form of stroke, and stroke is a major health issue worldwide. In the US alone, over 795,000 people suffer from a stroke each year, and intracranial hemorrhages make up a significant portion of these cases. Symptoms of a brain bleed. Brain bleed symptoms can vary depending on the location and severity of the hemorrhage, but common symptoms include sudden numbness or weakness on one side of the body, severe headache that comes on suddenly, confusion or difficulty speaking, dizziness or loss of coordination, nausea and vomiting, blurred vision or sensitivity to light, seizures or loss of consciousness. The first symptom of a brain bleed is often a sudden, intense headache that many describe as the worst headache of their life. Causes of brain bleeds. Several factors can lead to a brain bleed, including head trauma, falls, car accidents, or sports injuries. High blood pressure. Chronic high blood pressure weakens blood vessel walls. Aneurysms, weak spots in blood vessels that can burst. Arteriovenous malformations, abnormal tangles of blood vessels. Cerebral amyloid angiopathy, a buildup of amyloid proteins in the brain's arteries. Blood clot disorders and use of blood thinners. Risk factors for a brain bleed. Certain groups of people are at a higher risk for brain bleeds, including older adults, over 65 years old, people with uncontrolled high blood pressure, those who smoke or use drugs, individuals on blood-thinning medications, those with congenital vascular abnormalities. Complications of a brain bleed. If not treated quickly, a brain bleed can lead to paralysis or weakness, memory loss, loss of coordination, vision problems, personality or emotional changes, in severe cases, coma or death. Diagnosis and tests. To diagnose a brain bleed, doctors perform a physical and neurological exam and use imaging tests such as CT scans or MRIs to locate the bleed, angiograms for detailed images of blood vessels, lumbar punctures or other tests to determine the cause and severity of the bleed. Treatment options for a brain bleed. Treatment depends on the cause and severity of the bleed. Immediate care focuses on stopping the bleeding and reducing pressure on the brain. Treatment options include 1. Surgery. Decompression surgery to relieve pressure. Craniectomy to remove part of the skull and treat the bleed. Craniotomy to access and repair the source of the bleeding. 2. Medications. Antihypertensive medications to control blood pressure. Anti-seizure drugs to prevent seizures. Steroids to reduce swelling. Pain relievers to manage discomfort. Some smaller bleeds may not require surgery, but close monitoring in an intensive care unit is often necessary. Rehabilitation after a brain bleed. Recovery from a brain bleed often requires long-term rehabilitation, including physical therapy to regain motor skills and strength, speech therapy to help with communication, occupational therapy to relearn daily tasks, lifestyle modifications to reduce the risk of future strokes. Can brain bleeds be prevented? While not all brain bleeds can be prevented, managing high blood pressure, staying active, and eating a healthy diet can reduce your risk. It's also important to avoid smoking and limit alcohol, wear protective gear during risky activities, manage any underlying health conditions. Prognosis and survival. Survival after a brain bleed depends on how quickly you receive treatment. If treated early, your chances of recovery are significantly higher. However, severe brain bleeds can lead to long-term complications or death. Always seek emergency care if you suspect a brain bleed. Act fast to save a life. A brain bleed is a medical emergency, and time is of the essence. If you or a loved one experiences symptoms like a sudden headache, confusion, or numbness, don't wait. Call 911 immediately. Remember, early treatment is critical for the best chance of recovery. Stay informed, take care of your health, and subscribe to Dr. Mai, sharing medical knowledge for more life-saving information on medical conditions and treatments. Thank you for watching, and don't forget to like and leave a comment with your questions or topic suggestions below. Stay healthy, stay informed.